Effect of dramatized health messages. Modelling predictors of the impact of COVID-19 YouTube animated cartoons on health behaviour of social media users in Nigeria. Studies on the impact of internet-powered media on health promotion neglect the relationship between message recall and health behaviour. This makes it look as though exposure to media messages automatically leads to recall. There's also little attention put on understanding if perception of a public health issue influences effectiveness of intervention. The researchers suggest a model that takes into consideration these existing gaps through this study. In particular, the model aims to predict the effectiveness of COVID-19 YouTube animated cartoons on health behaviour of social media users. The study pays particular attention to those based in Nigeria. Researchers used a survey research design to conduct this study. They examined 470 social media users exposed to YouTube animated cartoons on COVID-19 in Nigeria. Multiple regression and hierarchical regression were used to analyse the data for the study. The analyses were done with SPSS version 22. Recall was largely predicted by exposure. Respondents with irregular exposure are less likely to recall the cartoons. This is in comparison to their counterparts, whose exposure was between 1 and 3 times in a week. Social media users who reported daily exposure are most likely to recall the cartoons. Both exposure and recall are variables that significantly predict health behaviour. On a comparative note, recall predicted health behaviour more than exposure. The effectiveness of YouTube animated cartoons on COVID-19 can be explained in a 2-dimension model. Perception concerning realness of COVID-19 was the greatest contributing factor in predicting effectiveness of YouTube animated cartoons on health behaviour. People need to first believe a health issue exists before they think about susceptibility and its seriousness. This is based on the study's model.